let's talk again about the timeline. How long does it take to develop symptoms after contracting coronavirus? As you heard from Siobhan, as you heard from Zeke, there's a lot of questions about some of these other lawmakers and whether or not they're out of the woods. What do you have to say?
Well, Lana, nobody is out of the woods, and that's the thing about the coronavirus infection. It can turn on a dime, meaning that you can be well and 3 hours later become dreadfully ill. And that's a big, big issue. And that's what I'm afraid that the physicians taking care of the president are aware of. And that's why he is being moved to Walter Reed. This is a precaution indeed. The president may do very, very well. He only has one comorbidity, and that's obesity. And so when, in presuming he doesn't have diabetes, hypertension, chronic lung disease, heart disease, he should do very well. Now, he could have acquired this virus at the Rose Garden Amy Coney Barrett welcoming, because I saw a lot of people there, as I said earlier, that were not wearing masks, and they were sitting very close to each other. And I know how these things are. The president probably did a lot of handshaking, probably spoke to a lot of people, maybe posed for photographs, etc. Amy Coney Barrett, the judge candidate, has already had COVID, so she probably has neutralizing antibodies in her blood. Nevertheless, it takes sometimes 3 to 5 days for the disease to show up and manifest, as we have just seen with the president and the first lady. So now I'm concerned, of course, because he is over the age of 70, and over the age of 70, you fall into that group where the survival is 94.6%, which is pretty good. Most people have no problem handling this virus, and I'm sure the president is going to be absolutely fine. However, that is like a Russian roulette. We don't know who will get very, very sick and wind up on a ventilator. We have seen healthy young people wind up in the hospital on a ventilator, athletes, 25-year-olds, etc. So we don't know where the president stands there. He's very energetic. He doesn't drink. He doesn't smoke. All of those things are in his favor. So I'm very, very hopeful that he's going to do very well. And I'm glad they moved him to Walter Reed. Lana?
Well, as you say, the survival rate is quite high, and there is obviously nobody in the world who is getting better medical attention right now than President Trump for the coronavirus. A White House doctor said that the president took an antibody cocktail and vitamins like zinc and vitamin D, all to try and boost his chances at beating the disease. Tell us more about the types of treatments you would expect the president to be on. And if you can tell our viewers a little bit more about this antibody cocktail, which I think is quite new for most people.
Well, let's go to the antibody cocktail first. What we have been doing is collecting blood, and the Red Cross is really behind this with us. We are also involved in a Mayo Clinic clinical trial, and there are many hospitals around the country who are collecting blood and sera from patients who have recovered. They have high titer, that means a high strength of these proteins in the blood called antibodies. These antibodies are directed to the spike proteins on the coronavirus. So if you infuse purified and highly concentrated polyclonal, that's the key word, polyclonal antibodies into a person, you can actually save their life, because what will happen is the disease turns completely around. So this is not a full therapy yet. It's kind of experimental, but we have FDA approval to do this as part of research and also part of treatment. Now, there's another antibody being developed which is not approved, and that's a monoclonal antibody directed directly against the virus that's being manufactured in the laboratory. That's not FDA approved yet. I don't know if they'll even consider giving that to the president if his condition sours and he goes south, which I don't want to see happen. But that's what that's all about. That's what the polyclonal treatment is. Now, regarding drugs, there's a lot of controversy about hydroxychloroquine. The president, as you know, was on it for 2 weeks. I don't know if he continued it prophylactically. Dr. Connolly, his physician, had agreed to let him take it. That was fine. I hope he's not on Zithromax, because we have shown in the hospital that those two drugs as a cocktail have caused disturbances of the heart rhythm. So I am sure the doctors know this. The other things to take are, as you mentioned, vitamin D, magnesium, and of course, remdesivir is something that works very effective. It's an antiviral drug which we use in the hospital, critical setting. We take care of people who are quite ill with that drug. Then we give patients steroids to control their immune system. And we also give them blood thinners to prevent microclots from forming in the lung. That has been a source of death for many, many patients in our intensive care units. We put less people on ventilators today than we used to. So I think that it's going to take a heck of a lot of hypoxia, that means low oxygen, to allow us to ventilate the President of the United States. I don't think that's going to happen. He looks too good for that right now. But as I said, that can turn on a dime. It can change within hours. Lana?
Thank you, Dr. Lahita, for making sure that we understand fully what's going on.